Imagine for a second you're a hospital patient. You spent the last couple of months confined to a hospital bed, forced to undergo all kinds of tests and treatment, and yet despite all of this, you were still incredibly ill and showed little to no signs of recovery. In fact, such is the pain that you want to die in order to give yourself a dignified death, and have asked your doctor, who has been with you through this whole process, to help you carry out this act of euthanasia. The doctor now has two options. On the one hand, they can help fulfill their patient's final wishes and allow them a dignified death and for their pain to end. But on the other hand, they can stay true to the Hippocratic Oath and can continue to fight on to help save the patient's life, no matter whether there may be a cure or not. We're going to be arguing why the doctor should choose the first option.
So what is euthanasia? Euthanasia is defined as an act of deliberately ending a person's life in order to relieve their suffering. For example, giving a patient with a terminal illness a drug that will kill them is an act of euthanasia. Research has found that 300 to 650 dying UK citizens take their lives every year, with 6,500 others attempting. Under the current law, assisting someone in an act of suicide is punishable by up to 14 years in prison.
The goodwill argument. First point is that goodwill is the source of moral worth. The second point, a goodwill is one which acts for the sake of duty. The conclusion, an act is morally right if A, it is your duty, and B, if it is motivated by goodwill. So how do we apply this to euthanasia? An act of euthanasia can be considered an act of goodwill because 1, the intention of the doctor are to relieve the suffering of the very ill patient, and 2, a doctor has a duty of care to their patient, for example, the do no harm principle. Sometimes when a patient is suffering, there isn't much hope for a cure. The doctor would do more harm by artificially prolonging their life with man-made machines and medications, which usually lower the quality of life. Therefore, in such cases, the doctor could act upon their responsibility of care for the patient by helping them and end their suffering. It is the doctor's duty to help them die, as that would minimise harm towards the patient and family members, who would otherwise have to witness their loved ones endure this pain. 3. This maxim, basic rule that applies to this situation, which in this case is doctors should allow very ill patients to die if they want to, can be universalised.
Another ethical theory that can be applied to this question is preference utilitarianism, a theory that is strongly advocated by a contemporary philosopher, Peter Singer. Those who follow this theory believe that our ends may often be pleasure, but this is not always the case. Therefore, this is an example of non-hedonistic utilitarianism. The theory supports voluntary euthanasia as it aims to maximize autonomous choices of people. So if a patient believed that receiving euthanasia would be beneficial to them and is in their preference, then it is the morally right decision to make. The theory takes into account the patient's wishes and their right to patient autonomy. It is their body and they should be able to make their own decisions about it. Another important aspect in this argument is consent. Consent is the permission for something to take place. This can be used in fields such as law, medicine, and relationships. In the context of the ill patient and the doctor, the ill patient is actively consenting to being put to death by the doctor, knowing well of the consequences of this decision. Therefore, the doctor cannot be blamed for murdering the ill patient, as they are simply abiding by the patient's wishes. And ultimately, it is the patient's body and their choice of how they would like to live their life.
So in conclusion, we believe that under the circumstances where a patient is terminally ill or suffering with no hope of a cure, it is the doctor's responsibility to ease their patient's pain in addition to helping the patient survive, which means if it is the patient's will to take euthanasia, then they should go through with it, as that would minimize the pain of the patient. This would allow this person to meet their own death with dignity on their own terms. It also gives the patient full autonomy as they are part of the process of determining their treatment.